Good evening, everyone. I am Dr. Rahul Karimungi. I'm a cardiologist by profession. I'm currently working in Ashwini Rural Medical College and Hospital in Solapur, and I do work in Journey Heart Care Clinic as well. So, for today's meeting, we'll be discussing about the healthy diet for the healthy heart. So, what are these concepts? How to keep your heart healthy and long lasting without having any heart disease in the future. So this is very important topic for you, for us, and for everyone. Your patients, patient relatives, or those people who don't have any heart disease right now, those lucky people. So we'll start with the healthy diet required for the healthy heart, how to keep your heart healthy. So first of all, I will talk about the importance of low salt diet, low salt in the regular diet. So basically, in your regular diet, whatever you eat daily, try to keep salt intake as much as low as possible in the form of stop using a pinch of salt over and above what is already there in the in your diet or in your food. Plus, reduce food intake of food of the processed foods or canned foods where there is a high salt concentration, or in particular dietary items like we call it as pickles or onion or potato chips. All these foods are very high. They have high sodium intake, sodium concentration. So such foods need to be avoided altogether to prevent rising blood pressure. That is called as hypertension. So hypertension is a risk factor for future cardiac events, for future stroke events, for future kidney problem, for future eye problem in the form of blindness due to hypertensive retinopathy. So hypertension is a silent killer. We call it as a silent killer because most of the patients, they don't know they have a hypertension. So unless they get diagnosed at the hospital, when they have a complication in the form of heart attack or in the form of stroke, either in the form of bleeding in the brain or clotting in the brain, that is called as ischemic stroke, or in the form of chronic kidney disease or kidney injury, or there may be a blindness due to hypertensive retinopathy in the later stages, that is called as grade 4 hypertensive retinopathy. So unless complication happens, most of the people, they don't know they have hypertension because the concept of regular checkup in our country is very less. So most people, they ignore their health, thinking that they don't have any risk factors or diseases, which is a very wrong concept. So here comes the regular health checkup, the importance of regular health checkup in all the individuals in our country, because particularly in India, we Indians, they are at high risk of developing heart diseases because already we are a diabetes capital of the world, we are becoming hypertension capital of the world. So all the two major risk factors, they contribute to maximum of cardiac diseases. So India is going to be one of the heart disease capital as well in the future if it is not controlled now. I talk about the salt intake. You have to reduce the salt as much as possible. Use more fruits, more vegetables, green leafy vegetables like uh, then legumes, seeds like pumpkin seeds or sunflower seeds in your regular diet. Use carrots, use cucumber as a substitute to reduce the salt intake in a diet. So try to eat as much as possible the fibers, dietary fibers, which help in digestion as well as reducing your glycemic index, which is called as reducing the sugar absorption in the stomach or in the intestine. So that helps in reducing the blood sugar levels as well as reducing salt intake. So dietary fibers is one of the important factors to reduce the blood sugar levels, to reduce hypertension, to reduce blood pressure levels, as well as improving the gut motility. So all these high fiber diets like vegetables and fruits. So use whole fruits. Try to avoid fruit juices as much as possible, because if you use a fruit juice, there will be crushing of the dietary fiber, the crushing of the fibers in the fruit, as well as there will be more sugar added to the juice. So try to reduce fruit juice intake as much as possible. Use whole fruits instead, as well as green leafy vegetables in your daily diet, along with high intake of proteins. Proteins in the form of pulses, or in the form of, if you are non-vegetarian, you can use fish. You can include fish, or you can include poultry products like chicken. Avoid red meat, that is very high in fat content, as well as causing high cholesterol, high triglyceride levels. So that will red meat will cause rise in bad cholesterol in your body, which is itself is a risk factor for heart disease as well as stroke. So bad cholesterol, we call it as LDL and triglycerides. In Indians, generally, if we speak the dietary pattern, we have more of a triglycerides and more of LDL and less of HDL. HDL is a good cholesterol. So what is the most important thing is try to reduce as much as fat as possible, bad fat or saturated fats, which we usually have outside. The food we eat outside, the fried foods. Try to avoid it as much as possible. Don't use fried fish or fried chicken. All those things should be avoided. Instead, you can use boiled one or the steamed fish as at least twice a week is recommended instead of using as a fried items. So cut down your calories with your reduced fat intake, cut down your salt intake, cut down your sugar intake by reducing sugar, diet use of sugar in your food, diet use of jaggery in your food. So all these factors will decrease your calorie intake in daily. So itself will reduce your body weight. So once the body weight is reduced, your calorie intake is reduced, your cholesterol will automatically come down. Once cholesterol comes down, your bad cholesterol will come down, and HDL, that is the good cholesterol, will increase. So this is the normal dietary improvement which is required in all the individuals, instead of irrespective of whether you have a heart disease or not. To the people who don't have a heart disease, the lucky people, they can use this recommended food products or items. They can include in the daily diet, and along with that, lifestyle modification, which we call as dietary modification plus regular exercise. Regular exercise in the form of brisk walking or jogging, whichever is convenient as per the age. So brisk walking at least for 30 minutes per day or at least 5 days a week is recommended by the WHO or recommended by the American Heart Association. So that is a minimum requirement. You can do as much as possible, but minimum at least 30 minutes per day a week or 150 minutes per week is recommended. So that is minimum. You can do as much as possible over and above the particular recommended duration of exercise, brisk walking or swimming or jogging. So that is to help burn your calories, to keep your heart healthy, to increase your heart cardiac output, stroke volume, which called as. So heart is nothing but a muscle. So as just like you exercise your other muscles of the body, your heart also needs exercise. So try to do as much as possible at least in the morning hours or in the evening hours, not after meals. It should be done before meals. Try to do as much as possible daily. Make it a habit of exercising regularly, whether you have a heart disease or not. And along with that, dietary modification. So these exercise as well as dietary modification is combinedly called as lifestyle modification. So irrespective of whether you have a risk factors like diabetes or hypertension or high cholesterol levels, or whether along with any other disease like heart disease, already you have a heart disease or peripheral vascular disease, pain in the limbs, or difficulty in or vision problems due to hypertension retinopathy or diabetic retinopathy. So all these irrespective of risk factors, dietary modification along with lifestyle, along with exercise is a must. Medicines, they add to the benefit to the patient, but only medicines will not benefit the patient. So you need to add lifestyle modification along with medicines which you are taking. So try to all those people who are in the younger age, or those who don't have any heart disease or any other diseases, lifestyle diseases. So right from the beginning, try to modify your diet as per the recommended, along with the regular exercise to prevent future development of risk factors, as well as development of heart diseases or cardiovascular or cerebrovascular disease or peripheral vascular disease. So what this Uh, peripheral vascular disease means pain in the limb while walking. So that happens because there is a cholesterol deposition and blockage in the lower limbs, in the arteries of the legs or the hands. That happens because dyslipidemia, that is increased cholesterol level over long time, along with smoking or tobacco intake. So all these factors they combinedly form they are high risk factors for development of peripheral vascular disease, cardiovascular disease, as well as cerebrovascular disease, including deposition of cholesterol in the kidney arteries as well, causing renal artery stenosis. So regular exercise along with dietary modification is a must for all individuals, irrespective of their health status, for keeping their heart healthy. Those people who are smoking daily, who are in a habit of smoking along with nicotine intake in the form of tobacco intake, so all those people need to reduce the intake. You cannot stop altogether. Need counseling by psychiatrists for de-addiction. So try to counsel, try to visit a psychiatrist if not possible to stop altogether the intake of alcohol as well as tobacco. So that will help in future reduction in cardiac events or development of risk factors. Tobacco intake or alcohol itself is a risk factor for future cardiovascular events in the form of heart attack or in the form of arrhythmia, that is called as increase in heart rate or decrease in heart rate, causing loss of consciousness or giddiness, all those risk factors. So uh, I already talked about regular diet, inclusion of fat, inclusion of dietary fiber, fruits, vegetables. Along with that, there are the other types of diet recommended by the American Heart Association or other associations all over the world. One or two of them are the most popular. That is called as DASH diet, dietary approaches to stop hypertension. That is called as DASH diet. That is particular for hypertensive patients. Particularly, it is nothing but diet which has more of fibers, more of fruits, more of vegetables, with less salt. So that is DASH dietary approaches to stop hypertension. That is recommended for hypertensive patients, not only with on medicines as well as they need dietary modification as well along with the medicines. So you can include this DASH diet in your regular approach to reduce hypertension. Initially, it's a little bit difficult, but try to do as much as possible. Reduce salt intake, reduce fat intake, increase protein intake, increase dietary fibers, that is increase of fruits, vegetables, and reduce reduce uh, alcohol intake as well as tobacco intake. So these risk factors need to be identified in each individual, and accordingly these needs to be reduced or stopped altogether. If not able to stop the addictions, counsel a psychiatrist for de-addiction. So that will help. Along with that, regular health checkup, which is very missing in our country, because most of the individuals they don't visit a doctor or get routine checkup until unless they have developed any particular disease like heart attack or stroke or developed kidney injury in form of chronic kidney disease or developed peripheral vascular disease or gangrene. So until unless complications develop, we don't visit a doctor or don't get routine health checkup done. So to prevent all these risk factors or diseases to happen in future, you as well as your parents or your children, all of you need to get regular health checkup in the form of basic tests like blood test as well as cardiac test like lipid profile, fasting lipid profile, ECG, stress test, that is called as treadmill test. We try to do treadmill, ask the patient run on treadmill as much as possible. So we come to know about his exercise capacity, how much he is able to walk regularly, as well as whether he has any inducible ischemia, that is called as whether the patient has any heart blocks, which are more than 70%. It can be diagnosed on stress test, treadmill test, before patient develops any heart attack. So these are basic tests: fasting lipid profile, blood sugar, that is fasting blood sugar, and postprandial blood sugar, along with complete blood count, renal function test, which includes serum creatinine, serum electrolytes, and blood urea nitrogen, along with ECG, 2D echocardiogram, that which 2D echocardiogram nothing but is the ultrasound examination of the heart, which helps in identifying any valvular problems like any regurgitation or any stenosis of the valve, narrowing of the valve, or any reduced ejection fraction, reduced functioning of the heart muscle. We call it reduced ejection fraction or normal functioning. So that is the basic test, ECG and 2D echocardiogram along with stress test. So these three tests for particular individual as a cardiac patient or as a cardiac person, these tests need to be done. ECG, 2D echo and stress test along with blood tests like lipid profile already discussed, fasting lipid profile. To know the cholesterol levels, it needs to be done on a fasting state in the early morning, but after 12 hours of fasting. So you should not take any water, even water or any food in the morning before taking this test. Along with fasting blood sugar and the post-prandial blood sugar, that is blood sugar to be tested after 2 hours of food intake. So these basic tests are a must for all individuals. Try to get as much as possible, at least above 40 years of age. So there is recently what I have seen in our practice, regular practice is more and more people are getting heart diseases at younger age. Because even 25-30 years of people, aged people, they are developing heart disease in form of heart attack or stroke. That is because there is no dietary restrictions, no more alcohol intake, more tobacco consumption. So all these risk factors started, all these consumptions of all alcohol and other tobacco early in life will lead to development of heart diseases in early age as compared to the previous generation people. So premature atherosclerosis, called as premature atherosclerosis, that is development of dyslipidemia or development of fat deposition in the heart muscle, in the heart arteries or in the cerebral arteries before the age of 45 years. That is called as premature atherosclerosis. So all these risk factors lead to development of cardiac events, cerebrovascular events, neuropathies, hypertension, diabetes. So routine health checkup or routine cardiac checkup, preventive health checkup is a must for all individuals who are above 40 years of age. Try to get it done every yearly or at least once in 2 years. So those patients who are already heart disease patients, diagnosed with heart disease or ischemic stroke, all those patients need to get at least yearly this blood test as well as cardiac examination test. So today we have discussed about the importance of diet, low salt intake in the diet, low sugar intake, and as well as higher protein intake, higher protein in form of pulses or if you can eat eggs or poultry meat, whichever is possible, because protein intake protein intake is calculated as per as 1 gram per kg body weight. So if a particular person is 60 kg weight, then his intake should be at least 40 to 50 grams of protein, daily protein. But in India, we see our diet has most of the carbohydrates and very less protein, hardly 5 or 6 grams of protein daily. If you calculate your daily food intake as per your food intake daily, there's hardly any protein in the food. So increase your pulses, increase vegetables, increase fruits. If you're eating non-vegetarian, you can have poultry, meat, or eggs, egg white particularly. So that will help in increasing the protein intake. So that is required for muscle building or to prevent any wasting of the muscles. So that is about the protein intake. As well as reduce alcohol and as well as tobacco if not possible to stop it. If you are thinking of stopping it, visit a psychiatrist for counseling. They will help you in reducing as well as stopping it altogether, which will benefit you in the future, as well as reducing the salt intake to prevent hypertension as well as future cardiac events. Sugar intake, reduce sugar intake to prevent diabetes. You can at least not, if you're not able to prevent diabetes in those people who have a hereditary history, at least you can postpone or you can prolong the development of diabetes. Along with regular exercise, at least 30 minutes of brisk walking or jogging or swimming per day for at least 5 days a week, or at least 150 minutes per week is recommended. So all these dietary modification, exercise, along with if you have any disease, the medicines of the particular disease is required for all of individuals, for all the patients to prevent any future recurrent cardiac events or cerebrovascular events. So today we discuss about dietary improvement in dietary habits, improvement in exercise in the form of brisk walking, that is, as well as weight training also we can do if possible. Weight training at least 3 days a week along with regular cardiac exercises. So to keep your heart healthy, you need to have a healthy diet, proper diet, which is rich in fibers, low in fat, low in salt, low in sugar, as well as regular exercise. Whether you do any kind of exercise, at least 30 minutes per day is recommended, is required to prevent, as well as regular health checkup to identify risk factors at the earliest stage. Risk factors in the form of diabetes, in the form of hypertension, in the form of dyslipidemia, that is high cholesterol. So if you identify these risk factors, we can treat as well as we can modify these risk factors and prevent future end organ damage like in form of MI, that is heart attack, or stroke, or kidney injury, or blindness in the form of hypertension or diabetic retinopathy. So try to inculcate healthy diet, exercise to keep your heart healthy. So I think I have given the adequate information for you all to identify yourself about the risk factors which may you have. So those who have not done your health checkup, regular health checkup, visit your nearest physician or cardiologist and get your health checkup, cardiac checkup done as early as possible. And identify get your blood sugar, blood lipid levels, blood pressure checked as early as possible. If any questions, can consult me. So my name is Dr. Rahul Karimungi. So I am currently working in Solapur. So I think we will end this note with I think the information is adequate for you. Thank you.